Hey people, today's topic of discussion is cholinergic transmission of ANS. This video holds great importance and so would recommend you to note down each point and revise it daily till you have it in your subconscious memory. I have tried to cover every information in a concise manner and so I hope you would like it. Let's start it. Okay, let's start with neurotransmission in parasympathetic nervous system. It is very easy. See, first the acetyl-CoA from the mitochondria comes and joins with choline. This choline comes in through a carrier-mediated transport. Now, acetyl-CoA and choline joins by an enzyme known as choline acetyl transferase. It forms acetylcholine, right? Now, this acetylcholine is stored in the synaptic vesicles. There are multiple synaptic vesicles in which the acetylcholine is stored. Now, if you have already watched my previous video, I told you there that when the action potential comes, these synaptic vesicles move to the presynaptic membrane. Then the acetylcholine is released into the synaptic cleft. Okay. Then we have the receptors here on the postsynaptic membranes. So in case of parasympathetic nervous system, we have muscarinic and nicotinic as mentioned earlier. And in case of sympathetic, we have alpha and beta receptors. Okay, so acetylcholine acts on muscarinic and nicotinic receptors and various effects are produced. Now what happens to this acetylcholine? Acetylcholine is broken down by an enzyme known as acetylcholine esterase into choline and acetate. Remember, the raw material for production was acetyl-CoA plus choline, but it breaks into choline and acetate. So this acetate, do not confuse it with acetyl-CoA. This choline here is used for the formation of acetylcholine again. So reuptake of choline. Now let's see how exactly the acetylcholine is broken by the enzyme acetylcholine esterase into choline and acetate. So this thing here is the enzyme acetylcholine esterase. It has two sites. This is an esteratic site and this is anionic site. Okay. The acetylcholine, which is the raw material here, which has to be broken down. The acetyl and choline here is bound by an ester bond. Okay. So we need to break this bond for the metabolism. How it happens? The choline here we know is positive charged and anionic site is negative charged. So it attracts. So choline comes and joins here, whereas the esteratic site breaks down the ester bond between acetyl and choline, and this is how they are separated. This choline is then reuptaken for the acetylcholine synthesis. Now coming to the most important part of ANS, that is receptors. Both in case of sympathetic and parasympathetic, you need to have receptors and everything about it on your fingertips, and pharmacology will be cakewalk for you, believe me. Okay, so let's start. So here in parasympathetic nervous system, as we know, we have muscarinic receptors and we have nicotinic. Muscarinic we have 5, M1 to M5, and nicotinic we have 2 types, neuronal subtype and muscle subtype, NN and NM. Okay, so let's have the intro. Muscarinic receptors are GPCR type, that is G protein coupled receptors, and nicotinic receptors are ion channel receptors. So if you have read about the secondary messenger system in physiology, you must know or recognize something about it. Okay, so muscarinic receptors are GPCR type and there are 2 subtypes, GQ and GI. So always remember this GQ thing is something positive. That means if action potential comes, something positive is going to happen, and GI is kind of inhibitory, means opposite of action potential. So whenever if you see GQ, something is going to add on, while in case of GI, something is going to decrease. Okay, so first GQ subtype, if you remember, IP3-DAG pathway which leads to increase in cytosolic calcium. So this is the mechanism of GQ subtype of muscarinic receptors. So examples are M1, M3 and M5. These 3 receptors work on this principle. Then what is GI subtype? It is decrease in CAMP which leads to activation of potassium channels and leads to hyperpolarization. That is opposite of action potential depolarization, right? So something is going to decrease here. So M2 and M4 acts by this mechanism. This was about muscarinic type. What you need to remember is GQ subtype M1, M3, M5 and GI subtype M2 and M4. In GQ subtype, the calcium is going to increase, and in GI subtype, there will be hyperpolarization. Okay. Now coming to nicotinic receptors, these are ion channel receptors, and both the neuronal and muscle receptors are going to act by same mechanism, that is opening of ion channels, sodium, potassium or calcium. Okay, the neuronal subtype of nicotinic receptors are present in adrenals, ganglions and CNS. We'll see further what happens due to these receptors, and these muscle receptors are present at the neuromuscular junctions. Let's start with each receptors. First coming to muscarinic receptors. So muscarinic receptors, as we said, we have 5 of them, M1 to M5. But fortunately, M4 and M5 we don't have to study much, it is not so significant, and it is found in CNS. So what we have to study and remember is M1, M2 and M3, which are functionally recognized. Let's start M1. So this M1, as we know from the previous slide, M1 and M3 are GQ subtype, so it is going to increase calcium level in the cytosol and hence leading to increased action potential. So where do we find M1 receptors? It is present in CNS and GIT. You have to remember this completely. So in CNS what happens? It increases cognition, learning, memory and motor functions. So this is some kind of positive effect. And in GIT it increases the gastric secretions. Okay. Now M2, as we know M2 is GI subtype, means hyperpolarization, that means opposite of action potential, so something is going to decrease. Where do we find M2 receptors? Easy, heart. What does it do in heart? In SA node it decreases the heart rate, AB node decreases the conduction velocity, and in atria and ventricles, the muscles, it decreases the contractility. So just remember, M1 is found in CNS and GIT, M2 is found in heart. M1 it increases the function of CNS and GIT, and in M2 it decreases the heart functions, that is heart rate, conduction velocity and contractility. The third one is M3 subtype. This is most extensive. As we know it is GQ subtype, so it will increase the action potential. Now where it is present? First GIT. अब बोलोगे GIT M1 में भी था, M3 में भी है, but what is the difference? So in M3 it increases the contraction or the peristalsis, but in M1 it used to increase the gastric secretions. Okay. Then exocrine glands. So here also it increases secretions. What are the exocrine glands we know? Like sweat glands, sebaceous glands, lacrimal glands, etc. Then in eye, it causes pupillary contraction or meiosis. In vascular endothelium, vasodilation by EDRF-NO mechanism, which we will learn later. Then in bronchi, bronchoconstriction, and in bladder, increase in contraction. So frequency of urination will increase. Again, I am telling all these receptors, where are they present and what all they cause in parasympathetic nervous system is very important. You need to have them on fingertips. Now learning about nicotinic receptors, which is very easy. We have 2 of them, NM and NN subtype. NM is muscle subtype of nicotinic receptor. So it is responsible for muscle contraction, easy. What is the clinical importance of it? So in disease, the autoimmune disease, myasthenia gravis, autoantibodies against these receptors are generated, which decreases the muscle contraction and leads to weakness and rapid fatigue of muscles. We will study everything about myasthenia gravis and its importance in pharmacology in next video. The second is NN subtype, that is neuronal subtype of nicotinic receptors. It is present in adrenal glands, ganglions and CNS. What do they do here? In adrenal gland, the acetylcholine comes. Here is the neuronal nicotinic subtype of receptor. What it does, it increases the noradrenaline in the cell of adrenal gland. Now, in adrenal gland, the cortisol converts this noradrenaline into adrenaline, and this adrenaline is released into the plasma. So this is the role here. In ganglions, as we saw in the first video of ANS, that in the ganglions here, always neuronal type of nicotinic receptors are present. So what is the action here? It generates the action potential. In CNS, it is same as M1 receptor. There also it causes CNS excitation. And here also the NN subtype causes CNS excitation. This was it about the video. I hope it was clear. There's a small request from my viewers. I would love if you would review my video on comments or DM me personally, as we Indians think यार क्या ही फायदा होगा बता के. But trust me, it gives a lot of motivation and satisfaction knowing that someone is learning from the efforts that you're making unconditionally. So it really would mean a lot to me. So do comment your views and subscribe if you haven't already. It would help me to be more consistent with making them. Signing off, this is Palak Sanghai.